Hello, this is Bethany Clay. This is my head-to-toe assessment, my summative head-to-toe checkoff. Here is my environment check. All right. Here is the iPad. Nothing on it. It's my patient. It's the area I'm going to be working, the walls around us. Okay, I'm going to leave. Good morning. My name is Bethany. Close the door behind me for patient privacy. I'm going to be your nurse today. Come in and do some hand hygiene, put on some gloves. Today I'm going to be doing a head-to-toe checkoff on you. If you wouldn't mind showing me that patient bracelet, and then could you just confirm your name and date of birth with me?
Ava Ray, June 12th, 2004.
All right, thank you. So like I was saying, I'm going to be doing a head-to-toe assessment on you. That's going to involve like me asking you some questions. I'm going to touch on you a little bit, listen to you with my stethoscope. Everything sound good? Alrighty, so as I have come in and began talking with my patient, I have assessed her appearance. She is well groomed. Her build is of medium height and stature. Her speech is clear. Her affect is positive. Miss Ava, do you know where we are today?
In my apartment.
And do you know why we're here?
To do a head-to-toe assessment.
And what month are we in?
November.
Oh my gosh, we are! Happy November of what year?
2024.
All right, the patient is A&O times 4, alert and oriented to person, place, time more than me, and location. Miss Ava, would you mind putting those arms out for me? I'm just going to take a look at your skin here. Have you noticed any changes in your skin recently? Like any changes in any moles or anything? Any new moles? Have you, excuse me, I'm like just having a moment. I'm just gonna move on for 1 second. Go ahead and say that my patient's skin color is consistent with her genetic background, a pink color. The temperature is warm to the touch. The moisture is consistent with the environment. The texture is smooth. And could I see your hand, please? The trigger returns in less than 1 second, so it is a healthy trigger. And do you have a history of any skin conditions or anything like that? All right, all good. I'm going to move on to an assessment now of your heart. So tell me, do you experience any like pain or tightness in your chest, any shortness of breath? Do you notice any swelling in your ankles or feet? Do you have a personal history of heart disease? Do you have a familial history of heart disease? All good. So now I'm going to begin by just putting my patient into a 30-degree angle here. I'm going to ask them to turn their head to the left. Thank you, and to the right. No JVD is noted at the 30-degree angle. Now I'm going to put my patient upright. Ask them again, head to the left for me and to the right. Again, no JVD is noted. So Miss Ava, I'm going to start touching on you again. I'm just going to feel your pulses here. All right. Alrighty, and the pulses are equal. They are moderate and equal bilaterally. I am going to take a listen to those areas as well. If you would do me a favor, and when you feel my stethoscope touch on you, just hold your breath for me so I can get a really good listen. Alrighty. Thank you. Thank you. There is no bruit present. Yeah, I think that that's it. No, it's not. It's really not. That was like nowhere near it. Okay. So now I am going to move on to listening to your heart a little bit here. You can breathe normally during this, so no need to hold your breath. I'm going to be listening for a minute and explaining some things as I do. Alrighty. So I'm going to first listen in the aortic area at the, second intercostal space on the right sternal border. Then I'm going to move over and listen to that pulmonary area, the second intercostal space on the left sternal border. Move down to that third intercostal space to listen to the Erb's point on the left sternal border. Now I'm going to move down to the fifth intercostal space on the left sternal border to listen to the tricuspid valve. Now the mitral valve on the fifth intercostal space on the left mid-clavicular line. Everything sounded great. I'm going to listen to all those places again with my bell. Sounds super awesome. Now, Miss Ava, I'm just going to listen now to your apical heart rate for 30 seconds. Multiply that number by 2 to account for your heart rate. All right, 30 seconds has passed. I'm going to multiply that number by 2 to get 82 for the heart rate. Now I will be moving on to the next part of my assessment. So Ava, now I'm going to assess your lungs. Would you mind, again, have you experienced any shortness of breath recently? Do you have a family history of lung disease? Do you have a history of upper, lower respiratory infections? Are you a smoker? Alrighty, then we can move on to, I'm just going to look at my patient for a moment. I'm going to inspect the rise and fall of their chest and note that it is symmetrical. My patient's chest, I notice no like lesions or anything like that. There is no there is no bulging or retractions in the intercostal spaces, and the breathing is unlabored, even, and good. It's normal. It's normal. Please. So now, Ava, I'm just going to touch on your chest a little bit. If you notice any pain or tenderness or anything, please let me know, okay? Alrighty then. How was that?
That's fine.
Feel okay? All right. No pain, tenderness, or crepitus noted. So now I'm going to touch on your chest some more, but now every time you feel me, if you would please repeat to me 99, okay?
99, 99, 99, 99.
All right. Tactile firmitus is equal bilaterally. I'm going to touch on you a little bit more, Ava. I'm going to do some like taps and stuff. Do a good listen, okay? And the lung fields are resonant throughout all lobes bilaterally. Now I'm going to take a big fat listen to you. When you feel my stethoscope, please just take a big deep breath, and then if I'm moving too quickly, let me know. Don't want you to get hurt or anything. Breath sounds are clear throughout all lobes. And Ava, I'm going to do something really quickly. It's going to seem a little bit weird, but I'm just going to touch on you, okay? On your belly, on your side. The AP ratio is 2:1. So now, Ava, I'm going to move to your back and kind of do everything that I just did. If you could scoot this way for me just a little tiny bit so I can do a better listen back here. So I'm going to move your hair. Thank you. Again, I'm going to start... Sorry. I'm going to start again by just inspecting my patient's symmetry as she breathes. Her shoulders rise and fall evenly. My goodness. Excuse me. I'm so sorry. Excuse me. Again, there is no bulging or retractions noted in those intercostal spaces. I am going to, again, Ava, I'm going to do a quick, you're going to feel me tapping on you just a little bit. Really quickly. All right, the lung fields are resonant bilaterally throughout the posterior lobes, not the middle lobe, just the posterior lobes, okay? So now, Ava, again, I'm gonna listen to you. Again, when you feel my stethoscope, take a big deep breath. If I'm moving too quickly for your breaths, please let me know. All right, the breath sounds are clear bilaterally throughout the posterior lobes. Again, not the middle lobe, the posterior lobes. Now, Ava, if you would just stand up for me really quickly. I'm gonna do another weird quick touch on you. All right, put my hands here. Now, yep, take a big deep breath for me. The chest expansion is equal bilaterally. So, Miss Ava, now I'll be moving on to the peripheral vascular portion of this assessment. I would like to ask you if you have experienced any pain or anything like that in your arms or legs. All good. And then have you experienced any swelling of your arms or legs? Perfect. I'm going to begin now by, if you would please show me your arms. I'm going to touch on you a little bit and feel and compare all of the different pulses. I'm going to begin here, whoa, with the radial pulse, and then I'm going to move to the ulnar pulses. Would you raise up your sleeves for me? These I'm going to feel separately to ensure I'm doing a thorough check. Alrighty. Now I would, radial, ulnar, brachial. Okay, now I would assess for the femoral pulse, which I will not do today on my nice friend Ava, but if I were going to assess for that, I would do it in that groin area between the groin and the leg. Yep. I'm going to move this camera down here with me really quickly. We are now going to assess Miss Ava's popliteal pulses. And we are going to assess her posterior tibialis pulses, as well as her dorsal pedis pulses. All right. All pulses were present, 2+ and even bilaterally. Now, Miss Ava, I am going to ask again to see your hand. I'm going to feel this radial pulse here for 30 seconds, and then count that number, multiply that number by 2 to get her heart rate, which again, still 82 because she is sitting at that number right there. Okay, now I believe we're going to move on. Oh no, I'm gonna check really quickly, Miss Ava, can I see that leg? Oh, there is no edema present. So now I'm going to move on to the abdominal assessment. Ava, have you noticed any changes in your appetite recently? Have you noticed any difficulty swallowing? Have you noticed any nausea or vomiting new in onset? Do you have a history of any abdominal yaps? Alrighty then, so that's good for that. I'm going to now ask you to please lay flat for me, put my patient's bed at a 0-degree angle. I'm going to come over and just look at her belly really quickly. I'm going to note that the color is pink and consistent with the genetic background. I'm going to note that there are no lesions on the belly. I will note that the contour is flat. I will begin by auscultating your stomach. Again, you can continue to breathe normally. Auscultate. I'd have my patient's bed raised, let me tell you. All right, now I'm gonna flip around here to my bell and just listen here on the aorta. There's no bruit present there. Now, my friend Ava is gonna help me out here because we're just really gonna make sure that all of this gets seen. Okay, so I'm gonna begin now, Ava, by percussing on your belly. You're gonna feel me tapping on you a little bit if that is okay. But I do have a specific technique I need to show my friends. Okay. Wrong finger, sorry. Alrighty, The tympani predominates throughout all 4 quadrants. Alrighty then. So now I am going to touch on your belly a little bit. If you feel any pain or tenderness, please let me know, okay? Feel okay? All right, no pain, tenderness, or masses noted. Now I'm gonna press a little bit deeper on your belly again. If you're feeling any pain, please let me know. All right, was that painful? Okay, there is no pain, tenderness, masses, or inflammation noted. Now, Miss Ava, if you would please turn over on that back form, or on your belly for me, I guess. The other way so I can access your back. Can you scoot this way for me just a tad? Thank you, my love. All right, now I'm gonna kind of tap on your back. If it's hurtful, let me know, okay? How was that?
Fine.
Okay. All right, Ava, do you have any questions for me today?
No.
All right, thank you so much. I'm going to take my gloves off, do some hand hygiene, make sure my patient has their call light, their bed is everything that they might need. I'm going to leave the room and close the door behind me for patient privacy. Thank you.